Okay, welcome to your Wellness Wednesday. If you're planning on spending any time abroad this winter, possible illnesses, other diseases in regions, other countries should be on your radar. This is Kara Moll from SSM Health. She's joining us now to talk about getting ready for that travel. Good morning.
Good morning. Thanks for having me.
Thank you for being with us. A lot of people right now in Wisconsin, let's get out of the cold.
Yeah.
You know, there's some warmer places abroad. So let's talk about how early we should start thinking about getting in touch with a travel medicine provider. First off, I didn't even know that there was such a thing.
Yeah,
so it's really interesting.
Yeah, a lot of folks don't even know that we have travel medicine as a medical specialty, but SSM has a travel clinic, and we would like to see folks generally, ideally 6 to 8 weeks before they travel if possible. But even up to the last minute, we see patients who are literally leaving for the airport from our clinic.
Yeah.
But ideally 6 to 8 weeks, that gives us time to give some vaccinations and have time for those vaccinations to kick in and be working by the time you go.
So are you the ones who will tell them, like, say, hey, I'm going to X, Y, and Z, and then you say, you need this vaccine, you need this vaccine, or this shot, so on and so forth?
Yeah, travel medicine, that's what we do in the travel clinic. We basically see the patient and we review their medical history, medications, allergies, what shots they've had previously, and then we talk to them about where they're specifically going, what countries, what cities, what provinces. We get detailed information about what activities they're going to be doing and how long they're staying, and then that helps us to really detail it out for them for their specific itinerary and their trip, what vaccines they need, what prescriptions they need to consider, and take care of all the needs.
And Kara, on that note, let's talk about the countries that are on your radar right now. What are we looking at?
Yeah, honestly, if you're traveling to anywhere in Mexico, Central America, the South American countries, Caribbean, Africa, Asia, those are all places where you would really want to consider seeing a travel medicine specialist.
What about other precautions out there should we be taking?
Yeah, so I mean, lots of vaccines to consider, things like hepatitis A, typhoid fever, yellow fever vaccines, depending on your itinerary. General precautions are things like food and water precautions. If you're traveling to countries where you can't trust the water, we kind of provide information for folks about food and water precautions and insect precautions, and then just give vaccines that are recommended for the specific itinerary.
And maybe a no-brainer here, but if you are concerned and you're overseas, what do you do?
Yeah, I mean, we try to prepare folks so that they have prescriptions that they would need for treatment of traveler's diarrhea, try to give them information about over-the-counter medicines they can take with them to treat different conditions, make sure that they're vaccinated for things that are most common in their destination, and just make sure they're prepared before they go, hopefully.
Good deal. Kara, any final thoughts for us? Anything I missed that you'd like to touch on?
Yeah, no, I think just would encourage people to seek out a travel medicine consultation if you're traveling. We're happy to help and get you prepared for your trip so you can stay safe and healthy on the trip.
It's so cool that you have those,
Yeah,
right? We're getting out of here. We're going to Mexico.
Sounds good.
Kara, thanks for being with us today. We appreciate it.
Thanks so much.
We'll be back after the break. Stay with us.